Patients can now give regular and relevant feedback on health matters for family doctors to tap for better research. A new health platform launched today by SingHealth Polyclinics partners the GP Co-operative of family doctors and global pharma AstraZeneca. It's called the Primary Care Research Institute. And for more, we have Associate Professor Tan Ngiap Chuan from SingHealth Polyclinics here in the studio.
And we also have Dr. Lee Yik Voon. He's Chairman GP Co-operative on Zoom, joining us as well. Let's start with you, Professor Tan. Now, this Primary Care Research Institute, it's a platform, so it's not an actual physical research facility. Explain to us what it is and how it will work.
First, we're happy to share the launch of the Primary Care Research Institute. While it is not a physical building, we have this hub and spoke structure. The hub is where the brain is located in our headquarters where our data analytics are cited. But the research space that are now being built in the newer SingHealth Polyclinics serve as our R&D hubs, where we can reach out to the study population easily because they are located within the heartlands.
So you need this group of dedicated patients who will be part of this group, this study group. How do they know what they need to do and how to supply that information? Give us an indication of how this group was selected in the first place, perhaps.
Right. So Primary Care Research Institute is unique in the sense that we do have a group of very dedicated research advocates. This is our way to involve the public and the patients to provide us with the feedbacks on study protocols. In this way, the conduct of research is safe, ethical, and hopefully the results are relevant to our patients that we serve. So how do we select these research advocates? We do have patients who are very articulate, who are always been giving us feedbacks. So we have invited them over and they volunteer their service, their time to contribute. And we met over Zoom. So they do not need to be physically within to come to the research facilities. And we presented the research proposals and they gave us very, very valuable feedbacks. In this way, we actually improve the way we deliver research and recruitment of subjects.
All right, Dr. Lee, let's bring you in on this one. Now, you are chairman of GP Co-operative and a family doctor. What we just heard from Professor Tan about, and I take it there's a brain and then these spokes that extend into the heartlands where patients can then give you feedback, data, I suppose, for research and development. Correct me if I'm wrong on any of this, but how do you see the Primary Care Research Institute as actually contributing to your work?
Well, as a GP and family doctor, we do the best for our patients, right? And to do so, we need to keep ourselves up to date and find better ways to manage our patients. And one way is through research, hence PCRI. With research and innovation, we will discover relevant, patient-orientated, and implementable real-world solutions. And of course, through this, we will also discover best practices that we can customize for our patients.
Professor Tan, there are numerous health issues that the populace may encounter at any one point in time. I mean, we've got the top 5 ones that kind of we tackle coronary heart disease and so on. Are there specific research topics that you are getting the feedback on from patients? I mean, you mentioned that there are some very vocal individuals within this study that want to give you this feedback. Can you share with us what these research topics might be? Right.
I'm happy to share one example. We have a current study to monitor the blood pressures of our patients on a continuous basis. So they need to put on a gadget. And in the original study protocol, the investigators would like the subject to wear both devices concurrently. And of course, the feedback from our research advocates is such that it will cause inconvenience to them because they have to look after both devices at the same time and over 24 hours. So as a result of the feedbacks, we have the investigators have redesigned the study protocol such that the subject will wear one device at a time and in sequence. So we actually are able to get the same results without compromising on the scientific robustness of the study.
All right, Dr. Lee, final question to you. Now, you mentioned how this platform allows you to stay up to date on best practices for how to manage your patients. And that might be particularly relevant given this is very much in the headlines these days, Don, Singapore heading into the aging society phase where by 2030 we've got 1 in 4 aged 65 and above. So how is this platform going to be partnering Singapore's Healthier SG plan to manage this aging population?
Well, as you know, Healthier SG is about prevention, right? Prevents the illness from happening, discover the illness before it happened, or pick up very early, or prevent infections like vaccinations, or prevents the infections from getting severe infections, right? That's primary prevention. Then there's also secondary prevention, whereby when the patient already has the condition, you prevent it from getting it worse and keeping it under control. And there's, of course, tertiary prevention, whereby we try to prevent complications. So hence you see the important role of research. With research, we will find better ways of doing all this. And hence, we will need research for Healthy SG, as this multi-year program will undergo numerous tweaking and improving along the way.
Dr. Lee,
hence research.
Professor Tan, thank you very much. That was Associate Professor Tan Ngiap Chuan, Director for Research at SingHealth Polyclinics, and Dr. Lee Yik Voon, Chairman of GP Cooperative.